Hi everyone. Sincere apologies for the delay. We had some technical difficulties. Um, anyway, good afternoon to everyone. My name is Priya and I'm a community pharmacist working in Watsons. Welcome to our Facebook Live segment on Ask Our Pharmacist. If you would like to hear to our previous recordings and sharings, you can find them under our video tab on the Watsons Facebook page. So moving on to today's topic, for today's segment, I'll be sharing about managing diabetes, which starts at home. And these are the overview of today's topic. So what is actually diabetes? Diabetes is actually a disease in which our blood glucose levels are actually above the normal range. And in healthy individuals, most of the food that we eat, right, it actually turns into glucose or sugar for our body to be used as energy. Whereas for those with diabetes, right, generally the pancreas usually will make a hormone called insulin to get this glucose into the body. When you have diabetes, our body either don't have enough of insulin, which is called a type 1 diabetes, and our insulin is not functioning well, which is a type 2 diabetes, and hence this is actually causing the blood glucose level to be increased in our body. So what are the common signs and symptoms of diabetes? In other words, hyperglycemia. So basically, you are drinking enough water, but you still feel very thirsty. You are going to the washroom, you're peeing more than usual. Your eyesight is feeling blurry. You are exhausted no matter how much you eat or sleep or rest. Sorry, how much you sleep or rest. You feel starved no matter how much you eat. And you're having numbness or tingling sensations in your hands, arms, feet, or leg. Or you're getting more infections like urinary tract infections. For women, you get yeast infections, and sometimes generally you have food infections as well. And lastly, you are losing weight even without trying. So these are some signs and symptoms of having a high blood sugar in your body. However, sometimes when you're taking medication to manage your diabetes, right, you should also be aware of some of the common signs and symptoms of having too low sugar in your body, in your blood. Low blood glucose can be dangerous, and if it occurs suddenly. So these are the few symptoms that you can look out for and what you can do. So for example, when your body is having too low sugar, you may feel hungry constantly, even just after eating. Sometimes your mood, your behavior, you may feel very moody, you feel very confused and anxious. Worst case scenario, you are unconscious, you faint. You will have shakiness and trembling hands, cold sweats, and also dizziness and also headache. Do take note that some of these symptoms could be the same as having high blood sugar, like I mentioned. So when in doubt, always remember to check your blood glucose levels. So what should I do when after checking my blood glucose levels, if you ask me? If your levels are below 4 millimole per liter, all right, eat or drink any of these following items immediately. So for example, half glass of fruit juice or 3 teaspoons of sugar, honey, or syrup, 3 sweets or hard candy, so make sure it's not sugar-free, or just basically a can of regular Diet Coke or, a can of soft drink, not Diet Coke, yeah? Do take note that food that has fat, chocolates, cake, or cheese, right, they don't increase your blood sugar levels that quickly. So when you experience low sugar levels less than 4, don't take these food items, yeah? Okay, so if you're asking how do I check my blood glucose levels, okay, there are basically many different meters available in the market, and each one of them works differently. So follow the specific instructions that come with a blood glucose meter. Generally, a doctor or diabetes care team will help you decide which is the suitable one to use. You can also visit your nearby pharmacy to find out more from the community pharmacists. They are more than willing to help to guide you. And Your doctor would generally advise you on which is the best timings to check your blood glucose levels and how often to check it. Generally, the best times to check are before meals. So basically, first thing in the morning before taking any medication, any food, right? Secondly is 2 hours after meals to see how your food affect your blood glucose levels. The type of food can affect the blood glucose levels. Other times is when you experience any low sugar symptoms, like I mentioned before or after exercise, to see how exercise affects your sugar levels. And lastly, of course, when you're sick, when you're not eating well and not getting enough nutrients, that can also affect your blood glucose levels. So do check it at those times as well. So what are the different glucose monitoring device available in the market? So basically, there's two different types. So one is your self-monitoring of blood glucose. In short, it's called the SMBG. Secondly is the continuous glucose monitoring. Okay, I'll explain to you one by one. All right, so this self-monitoring of blood glucose, right, it is basically our traditional way of testing blood glucose levels. So it consists of this meter, test strips, your lancet, which is a needle, and also the lancing device. Whereas this continuous glucose monitoring, it consists of a sensor that is inserted under your skin, and it has a reader to read the sensor your glucose levels. So the difference between these two is your SMBG measures the blood glucose level at the point of blood taking, all right? Whereas your CGM, continuous, measures your blood glucose level at any point of time of scanning, okay? And the traditional meter, the glucometer, involves the pricking of finger to obtain a blood sample, whereas this CGM, it doesn't involve a pricking. It's painless, and usually the sensor is changed every 3 to 14 days, depending on the model that we're using. Okay, and both these two meters can be used for type 1 and type 2 diabetes. However, continuous glucose monitoring is a more pain-free and a more convenient way to measure blood glucose level should you require like a very close and frequent monitoring of a blood glucose level, so you don't have to prick many times in a day. So these ones, the doctor will advise you, or if you're needing to prick your finger more in a day, right, you can always speak to your pharmacist and they can advise you on the pros and cons, and explain to you what are the advantages and disadvantages. Okay, so how do you actually control diabetes? All right. So diabetes is normally treated first with weight loss, diet, and exercise. Okay, these are the three main factors. If these fail to work, only then the doctor will give you prescription medications. However, this does not mean that if you're already on medications, then you don't need to control your lifestyle, because medications will usually work hand in hand together with these three factors as well. So what are the simple tips and tricks within these three categories that you can practice at home? All right. So first thing, weight loss. If you're overweight, aim to trim down. And studies have actually shown that losing 5% of your weight can improve your diabetes control. A healthy weight loss is actually about 0.5 to 1 kg per week. Okay, you can always learn what is a good weight for you by checking your body mass index, in short BMI. So there's actually various online calculators that you can use to actually help you to check this. Secondly is exercise, right? Getting fit is part of staying healthy and also fighting diabetes. So it does not mean that you have to exercise for hours each day or hit the gym daily. You can better manage your diabetes just by being active. For example, 20 minutes of moderate intensity exercise, or just simply taking the stairs, or 5 minutes walk to the bus stop, that is already sufficient enough. Together with your meal plan and diabetes medication when needed, regular exercise improves and controls your diabetes. by lowering your blood glucose levels. In addition, it also helps to control your weight, and sometimes it helps to increase the sensitivity of insulin, like I mentioned before, in your body. Right. Lastly is diet. Okay. There is no special diet for people with diabetes. Okay. You can enjoy the same healthy meal as everyone, ensuring it's a balanced meal. So this is like a recommended plate portion control by the Ministry of Health for Singapore. So if you can see, it contains half plate of vegetables, quarter plate of meat or other protein, and another quarter plate of whole grains. Do take note that every individual has different nutritional requirements. So if you have a dietitian or a special meal plan, your doctor or dietitian will advise you on the appropriate portion. So just follow their advice. But this is generally what a healthy individual should have. Next is to always moderate your consumption of rice and other starch. Okay, so you have to be very careful of the amount of daily carbohydrates you eat, as carbohydrates can actually cause your blood glucose levels to rise the most. Look for items with low glycemic index. High GI, in short, glycemic index, high GI foods items will raise your blood glucose levels quickly and in large amounts after meals. So, for example, here, pasta, noodles, starchy vegetables like potatoes, carrot, corn, and yam, right? They all contain carbohydrate, which can actually affect your blood glucose levels. So it's not to say you can't eat them. Spread them evenly throughout the day to manage your blood sugar. Instead, you can always select food that are rich in fiber to prevent the rapid rise in glucose in your blood. Okay. Next is obviously to moderate your sugar intake. Okay, sugar and sugar products contains carbohydrate, so they can affect your blood sugar. They are therefore the amount. How to say, these are. It's not to say you need to avoid totally. Okay, take it in occasions and in small amounts. Avoid snacks that are high in sugar content, for example, jelly, ice cream, chocolates, and cakes. Okay. Replace sweetened drinks with unsweetened ones. Look for options with less sugar in the market. Use artificial sweeteners like aspartame, saccharin as a substitute for regular sugar. Have fresh fruits instead of fruit juices. Okay, sometimes certain fruit juices has added sugar, so always check the labels. And canned fruits. Canned fruits are preserved and they are soaked in syrup, so it's high in sugar. Avoid those. Have fresh fruit instead. For dessert, instead of cakes, chocolates, choose a fresh piece of fruit. So that is actually good enough. Next is, so speaking of fruits, right? So the recommended intake for fruits is actually 2 servings per day. And I've already mentioned like choose fresh fruit juice instead of canned fruit. Another thing to take note is to limit the fat intake. Okay, the amount of fat has to be closely monitored because they can indirectly affect our blood sugar levels. Generally, avoid unhealthy fats such as trans and saturated fat. Sorry. And choose healthier cooking methods such as boiling or steaming them instead of deep frying. And lastly, of course, to avoid and to moderate alcohol intake. Okay, so try to stick to not more than 1 standard drink per day for women and 2 for men. Right, so these are the general guidelines that you can follow. So as a summary, take home for today, space apart your meals, eat small regular meals to avoid sudden spike of sugar levels, have small snack between your meals, and spread the carbohydrate that you eat evenly throughout the day, and reduce the amount of fats and salt, sugary food in your diet. Eat more food that are high in fiber, include whole grain products in your meal. And yes, very important, match your meal timings to your medication timings, because some medications you will need to take it before and after or after food. So do check with your doctor or pharmacist and educate yourself. Be aware of the signs and symptoms of low and high blood sugar and keep those handy glucose tablets with you always, so that in the event you've experienced any low glucose sugar level in your body, you know what to do, you know what to take. And always have a blood glucose monitoring device that's specially catered to you, or that's more suitable to you. Right? Okay, any questions? Mm. Oh, so I have a question from Helena. She's asking, how do I tell if my blood glucose levels are too high? Sure, that's a good question. All right. So the general recommended level for a adult, non-pregnant adult, okay, with diabetes is less than 7 before food, and less than 10 to be after eating. Okay, so this levels are just a general level. You will need to speak to your doctor or a pharmacist, because they would have a specific levels tailored to your health condition. Right. Any more questions? Oh, question from Colleen. What is low GI food, and is it better for diabetes? All right, sure. So as I mentioned, right? Okay. So this glycemic index, GI for short, right? It actually uses a scale from 1 to 100 to rank the carbohydrate foods. So the different types of carbohydrate food, on how quickly and how much they raise the blood glucose levels after eating. So for example, if you have a food that has high in GI, right, that will actually cause a very high spike in your blood glucose level after eating. And there are studies that actually shown that high GI food has led to an increased risk in type 2 diabetes, heart disease, and also obesity, and sometimes colorectal cancer. So generally for people with diabetes, eating lower GI foods helps to control the blood glucose level, and also improve aids in the weight loss as well. So I need to mention here, GI does not represent the amount of nutrients in the food, okay? So many nutritious food, right, actually have a higher GI than food with lower nutritional value. For example, oatmeal actually has a higher glycemic index compared to chocolates, because it has oatmeal is a food high in carb, and that will actually spike your sugar level right after eating it, compared to a chocolate. So like I mentioned, right, chocolate is not like a rescue food when you have a low sugar level, because that does not spike your glucose level as fast as compared to other food items. Okay. Any other questions? All right. So sometimes I do get questions from my customers saying that I only have diabetes. So if my diabetes is under control, I'm considered healthy, right? So I mean, diabetes is one of the chronic medicine, okay? Chronic disease, sorry. So it is not the only factor that you should be aware of. It is also important to get your other health checkups done as well. Okay. For example, take note of your BMI. Make sure you're on the healthy range, right? Monitor your blood pressure regularly, and also emotionally. All right. Make sure you are stress-free. Always engage in activities that are release stress. Make sure you do your physical exercises. Okay. Take note of try to go for checkups like every 6 months. This is usually done in your doctor's appointment. So during your health checkups, that will cover your cholesterol, your kidney function, your eye, food, dental check. So at least a year basically lah. Okay. Right. If there is any more question, I think we have short more time when time went on more already. If that's the case, thank you so much everyone for tuning in, and do look forward to our events more in future. And that's all from me. Thank you.